So when we're giving medications, how do we want to make sure we are doing this?
Clean.
Yeah, clean. Right, so hand hygiene's huge. Do you use the medication after you drop it on the ground?
No.
No, don't drop it on the ground.
They don't want us touching medicine.
Don't touch with bare hands, so use gloves. Yep, always use gloves. And then what about pill crushers?
Alcohol swab before and after.
Yeah, because if you're not doing that, you can get other people's medications in them, and it's just not good. So these are just like in a test, they'll just be basic questions, and you'll just kind of know, obviously, I can do that, right? So just keep it clean. Kind of think about like if someone was, like a nurse was giving you medication in the hospital, which already has germs, how you'd want them to give you medication. Okay, so number, is it 31?
Yeah.
Okay, that's fine.
So 31 is safety and accuracy in medication administration. So, obviously 5 rights, that is the most important thing, right? Also, before they go home on medications, make sure they know how to take them, when to take them, just basically everything that you do for them when you give medications, that they know how to do it too. Because if they're not following their medication regimen, it's not going to be like effective. So make sure they know their schedule, like if they should take it with food and water, how they should administer it, if it's like sub-Q, rotate sites, if it's oral, sublingual, things like that. And how we talked about beforehand, how to administer all those, teach them that as well. So like sublingual, don't drink it, like things like that. And then also like when to notify the doctor if they need a refill and who to call. So, okay, and then also with that one.
Is it always going to be notified doctor if they like run out of a prescription or like what?
Sometimes you just call the pharmacy for a refill.
Okay.
It just depends. Yeah. Usually, it just depends. The doctor will let you know. And then also with elderly people, what do you think their problem is with the medications?
Not remembering.
Yeah, they don't remember, they can't forget, they don't know. So if they have like a bunch of bottles, they're just kind of confused. So it's nice if you get them like one of those pill boxes with each day color coded. Just make it really easy for them. And then make sure they can read their labels too. Like the pharmacy can increase the font. So med delivery. So in the hospital you'll see this. Most of the time the nurse just gives them a bunch of medication, they take it. Sometimes though the patient can refuse the medication, so what do you think you do if they refuse the medication that the doctor ordered for them?
You like document it?
So yeah, so the first thing you want to do is make sure that you teach the patient, right? Teach them like sometimes what they reject it because they don't know what it's going to do, why it's going to help them. So they have deficient knowledge. So teach the patient like why is it important, what's it going to do for their health, how it's going to benefit them. And then obviously still teach them the side effects and everything. And then if they still don't want to take it, then like you said, document it. They have like in certain columns, they have like not given. You have to state why, because the patient does have the right to refuse medication. So be aware of that. And then you can even talk to them and like, why don't you want to take this medication? Maybe it's just because they don't like the brand or something. So then the doctor can prescribe a new brand, different medication. So really talk with the patient because they are the ones taking it and we can't just like feed them medication on medication.
Should we notify doctor after we document it that they don't take their medicine or they refuse the drug?
Yeah, especially if it's like an antihypertensive and they're not taking it. It's bad to have hypertension, right?
Mm-hmm.
Okay. Also with these, like, sometimes the patient won't swallow it, and they'll just say they will, and then they'll discard it. So make sure you're like, I know a lot of times the patient will be like, okay, I'll take that in like 10 minutes. But you should be like, no, I need to see you take it right now. So it's important to make sure they're swallowing it.
Older people do that a lot. They'll
Yeah.
hide it in their cheeks and in their clothing.
Mm-hmm, and they'll just spit it out after. Which I don't know why they wouldn't just say, I don't want this.
Yeah.
And then you kind of fix it, but yeah. Okay.